So a little bit of an overview. So what is the menopause? Menopause is a Greek word, meno meaning monthly and pause meaning to stop. So it's the stopping, the ending of monthly periods. During our 40s, generally speaking, our hormone levels start to decline. The ovaries realise that they don't need to work anymore and they start to shut down. So the production of the hormones starts to fall. This actually comes from the brain and the ovaries talking to each other in like a feedback loop. The pituitary is talking to the ovaries, and they're realizing that they're going to be producing less and less hormones. So as less hormones start, we develop symptoms of menopause that we love so well. So the stages of menopause are the peri-menopause, which we'll be discussing today. The day we enter the menopause is the first day of our very last period. That's why health professionals such as myself are so keen to find out about your menstrual cycles. So it's really important to keep a log of your menstrual cycles so that you know whether you're having a period every month, every 6 weeks, every 5 months, and how many days you're bleeding for. Are you bleeding incredibly heavy, light? It just gives a really good indication of what we think could be going on. So menopause lasts for a year. So once you've gone full 12 months without having a period, you are post-menopausal. And the only thing that means really is that it will alter any medication that we will prescribe. And of course, being post-menopausal, it increases your health risks associated with hormone deficiency, such as heart disease and strokes, etc. The types of menopause, the surgical menopause, obviously, when people have had a hysterectomy, either they've had just their womb removed or they've had their womb and their ovaries removed, can lead you into earlier menopause. If you've had your ovaries removed, obviously, as a full hysterectomy, then you're going to go straight into sudden menopause. If you've had your womb removed and your ovaries have been left, they will continue to produce hormones, but at a lesser level, and you will go into earlier menopause anyway. So I think the ovaries probably last a couple of years at the most, producing decent upper levels of hormones. So that's the surgical menopause. So with the surgical menopause, remember your hormones can crash. So one day they're up there, the next day they're not. We're all different. Some people don't notice the effect of the hormone imbalance for months later. Other people crash within 24 hours of not having those hormones. We're all different, and it's just being aware of those differences. A medical menopause is when you take certain types of medications, chemotherapy, rheumatoid drugs, for example, that will block estrogen production and estrogen being absorbed into the cell for very important reasons. So if there's no estrogen that's being allowed into the cell, then obviously you're not going to be utilising that estrogen and you will get estrogen deficiency symptoms. The natural menopause is something that obviously the majority of women go through, where you get natural decline of hormone levels from your mid-40s-ish onwards. What is HRT, hormone replacement therapy? So it's looking at replacing the hormones that your ovaries are no longer producing in good amount of levels to give you less symptoms and so that you can continue to function normally. So that's hormone replacement therapy. The long-term health after menopause, well, they vary between individuals. A lot of things are based upon your healthy lifestyle, your weight, your family history, your diet, the amount of alcohol you drink. So a lot of these will be impacted on your long-term health as well. But long-term problems associated with lack of hormones can be life-changing, increased risks of heart attack, strokes, thinning of the bones, and higher risks of certain types of cancers as well. Thank you. So the peri-menopause, because that's obviously what we're going to talk about today. I think this is it's a very important area, and it's quite a big area to discuss, because this is the one thing that normally people first associate with menopause. When you start to get symptoms of menopause, it's generally while you're still having periods. So the definition of perimenopause, peri means around. So around the time of the first day of your last period. So what this is then, it's the stage in your life leading up to the ending of your periods. So the perimenopausal stage, it can happen at any time, but generally speaking, we're talking about women in their 40s. We can have early menopause, such as with premature ovarian insufficiency. So that's women under the age of 40. And obviously they need a lot of interventions and lots of support. But the perimenopausal stage really will start from sort of like, mid-40s-ish onwards, in which hormone levels are just starting to naturally fall. So that's estrogen, progesterone, and testosterone. So that's what the perimenopause is. What happens to your body with the lack of hormones is the fact that we all have different kind of thresholds. So, your relative, your neighbour, your friend that you're sitting next to at work might be the same age, but you'll be having different symptoms of menopause, and it will affect you very differently. So it could be that one person has like a really high threshold when it comes to the symptoms. So they only have to have a very sudden drop, a very slight drop in their hormone levels, and they get horrendous symptoms of menopause. Whereas somebody else might have very, very few symptoms of menopause and might be a lot older before they start to get any symptoms of menopause. So remember, it's sort of like it's the reduction in the hormones. And during the perimenopausal stage, hormones will be fluctuating all the time. That's why things like migraines are really common. Periods can be, you can either have them monthly, or they can be lighter, they can be heavier, but it's just a sign of change. There's a lot of change going on in the body, and that can send you pretty crazy at times. It can give you lots of side effects. You don't know where you feel in a mood wise. One minute you're upset and crying, the next minute you're very angry, you have irrational thoughts, you can be extremely tired. So it's this whole transition, things are shifting from what you've experienced, sort of like from puberty onwards, and suddenly it's the change where things are happening. And remember that this is related to lowering and fluctuations of hormone levels. So when does the perimenopause start? Well, it can start any time. I mean, people, like I said, people can actually start to have perimenopausal symptoms in their 30s. Not that common, but it does happen. Generally speaking, perimenopause kicks in mid-40s, early mid-40s onwards. So as a rule of thumb, I think anybody over the age of 40, if you're starting to get these symptoms, definitely you've got to be thinking menopause. If you're younger than 40, then you do definitely need to have a chat to your doctor if you're not feeling very well, because you need to know the cause of it. It could be menopause, or it could be other things as well. But perimenopause, it happens to every single woman, and it's nothing that we can fight against. So yeah, 40s, early to mid 40s is generally when it starts. How long will it last? Well, it's a good question. It can last for quite a few years. So, on average, women can have these symptoms for, anything from like 2 to 3 to maybe 7 years of having perimenopausal symptoms. Generally speaking, a lot of women I speak to, it generally lasts for about 3 or 4 years. And then they enter the menopause, so then their periods will stop. But I think I said, we're all different. So it's just being aware of these symptoms and just monitoring your periods and monitoring how you feel and the severity. Are your symptoms getting worse? Are they improving? So how do you know that you're perimenopausal? Well, I suppose, as I say, if you're in your 40s, you're probably going to be thinking, well, menopause is going to start at some point. So is this perimenopausal? If you're under the age of 45, you can have some blood tests that will help pick up if your follicular stimulating hormone levels are higher than they should be. Now, the problem with blood tests, unlike other investigations we have with bloods, you've either got a yes or a no. We've got very strict parameters. If it's below this, it's normal. If it's a fraction over, it's abnormal, and we will do X, Y, and Z. With menopause, it's not like that. It only is there for a little bit of a gauge. Now, the problem with the bloods for menopause is that you can take them on one day and they will give you a reading that they might say actually you're within a normal range, and then you'll have them taken 4 days later and they might be abnormal, and they go, oh yes, you are experiencing menopause because your follicular stimulating hormone level is high. So as we get older, our follicular stimulating hormone levels will increase because they are trying to get the ovaries to work. So the pituitary gland is getting you to produce more and more FSH, follicular stimulating hormone, to try and coax the ovaries to produce more estrogen. So the hormones are being released to encourage the ovaries to work. So as we get older, our FSH levels will be high regardless anyway, because as we get older, our ovaries will fail. So there's no point doing a perimenopausal test if you're over the age of 45, because the reality is that your FSH levels will be high regardless, and I don't need an FSH test to tell me if you're menopausal or not. So it's based on symptoms, not bloods. So this is the one thing that people really get concerned about and confused about, is that they can have a blood test and they'll say, well, I'm not perimenopausal. The doctor said my bloods are normal. However, you've clearly got menopausal symptoms. So this is why blood tests have a place, but they do not diagnose menopause. They're a guide to the symptoms, but and a guide to your health. But for menopause, it's based on you and your symptoms. So I saw somebody that was 40 a few days ago. All her bloods were normal, but she clearly got menopausal symptoms. I saw a lady who was 39 recently. All her bloods were abnormal, and I immediately started her on HRT. So the fact is that everyone's different. Blood tests are important for some conditions, not so much with menopause. They're a guide. So blood tests under the age of 45 may help. Over the age of 45, I'm fully expecting your FSH levels to be high. So blood tests are pointless, and millions of pounds are wasted every year on blood tests for menopause when they are not. It's not necessary. So perimenopause is diagnosed by your age and your symptoms. So tests to diagnose it, there are no tests to diagnose it other than a consultation with somebody that understands about menopause, and then they can work that out for you, whether they believe your symptoms are related to menopause or something else. And if they believe that, one, you do have menopausal symptoms, fine. But as we know, we can have lots of other health conditions as well. So let's not discount other things. You might need bloods for your thyroid testing or B12 deficiency, for example. And so, bloods will help indicate that. But to actually diagnose menopause, the majority of the time, they are not required. Common symptoms of perimenopause we will discuss on the next slide. Thank you. Now, there are lots and lots of symptoms to the perimenopausal. And I think the one thing just to reiterate is the fact that you can be having regular monthly periods and you will still be perimenopausal, as it's based on symptoms. So if you're having periods every month, you can still be perimenopausal. I do hear, unfortunately, lots of people saying that their health professional has said that they can't be perimenopausal if they're having regular periods. That's simply not true. It's all to do with the symptoms, and this is what we're talking about today. So there are lots and lots of symptoms, as you're probably aware with the presentations we've been giving. There are about 34 symptoms of menopause. So I'm just going to give a bit of a run through of probably some of the most common ones. So aching joints and muscles. This is really common, and people do come to me going, I can't move in the morning. I've had to give up exercise. I've had to stop some of my hobbies that I like to do because of my aches and pains, fine finger movements, aching wrists, legs and hip pains. People spend a lot of money either, going to see people privately to have MRI scans, seeing rheumatologists privately, etc. Whereas I'll be thinking, well, let's consider menopause as a first rule, unless there's any red flags. Because if you are of menopausal age, then it could just purely be estrogen deficiency. And so it's a case of starting on potentially HRT and reevaluating the aches and the pains. Have we made any progress? Has it eased completely, a little bit, or not at all? Obviously, just making sure that there are no red flags there. So aching joints and muscles, really, really common during the menopause. Dry, itchy skin, yes, and another condition called formication, which is like insects crawling on your skin. That feeling that you've got ants or little spiders all over you, constantly scratching away. That's a common sign of menopause as well. But the lack of estrogen to the cells, the skin cells, they dehydrate the skin cells through lack of estrogen. So skin is dry, it's thin, lots more wrinkles, which obviously nobody wants to get. Frequent urinary tract infections, or even the symptoms, cystitis symptoms. Lots of women notice this, that they suddenly hit their 40s and they're having lots and lots of urinary tract infections, or certainly symptoms of frequency, incontinence, itching, in which they immediately think, oh, I've probably got some kind of like fungal infection. They'll reach for the over-the-counter medications to treat the fungal infections. It might ease things to fraction, it comes back with a vengeance. What we have to think about is that why are we getting more frequent urinary tract infections, or certainly the symptoms of that? The most common cause of this is lack of estrogen to the vaginal tissues and the whole of the genitourinary tract. It's really common, and I prescribe lots and lots of vaginal estrogens, and they have a huge effect on these symptoms. Even if you've got very mild symptoms of burning, itching, soreness to the vagina, or you've noticed any changes or appearance to the vagina, the vulva, the clitoris, anything like this, you've got to think what is going on, and you need to seriously get some help with this and work out, is this lack of estrogen that's causing these symptoms? Because incontinence, UTI, and all these vaginal symptoms, as I said, it's genitourinary syndrome of menopause, and that encompasses all of those problems. Are really, really common, and they have such an impact on people's quality of life. A lady I consulted with them yesterday told me that she had a little bit of vaginal dryness. Sex wasn't affected, but she just felt uncomfortable through the day. It was distracting her from work and wearing certain clothes. And so I said, you really do seriously need to think about some vaginal estrogen to combat that, because it's impacting upon your quality of life. Then we need to do something about it. Complete exhaustion, that feeling that you go to bed exhausted, you wake up exhausted, and it never improves. That's another common symptom of menopause. The lovely weight gain, which it's really good, isn't it? Middle-age spread, so we tend to put weight around our midriff, so we look more apple-like. And, men put weight on in midlife as well, but, it's something that obviously weight gain is something that we battle with most of our lives, whether that's right or wrong, but it's just a fact. But we will put weight on as we get older, and it's being aware that we're going to put weight on. But the lack of estrogen makes our body store extra fat cells, generally around our midriff, and the body thinks it's been really good by giving us this extra estrogen in the fat cells that will combat the estrogen deficiency we're experiencing. But unfortunately, it's the wrong type of estrogen. It's not the estrogen that will improve our menopausal symptoms. So we just have lots of fat, and it doesn't really do anything other than make us rather fed up. Hot flushes and night sweats, they're really common symptoms of menopause. They're probably the most common ones. Not everybody has them. They affect about 75 to 80% of people. So if you've never had a hot flush, you've never had a night sweat, but you have other symptoms, it's still menopause related until proved otherwise. Again, with all these things, if you are in your 40s onwards, menopause is the first thing you need to be thinking about, and then reevaluating. Somebody was saying to me that I think she was in her early 40s, and she was having some night sweats, and her GP was red flagging it as possible cancer risks. and sent her for a whole load of bloods, which were completely normal. I said, well, I said, obviously the GP has been very thorough, but the most important thing is that night sweats in your 40s, the most likely cause is going to be menopause. So it'd be a good idea to start you on HRT and then reevaluate how significant these symptoms are. If they haven't gone at all, obviously then it's red flag and needs investigating. Poor concentration, yes, that can be really life-changing. You know, you could be making some serious errors at home, at work, driving, and that will in fact just create lots and lots of emotional effects as well. Because if you've got poor concentration, you're forgetting to do important things at work, you're making some clinical errors. These are life-changing for you, people that you're caring for, and obviously the company that you're working for as well. Thank you. The psychological effects of low hormone levels or fluctuating hormones: increased anxiety, reduced confidence, that horrible sick feeling of dread. You wake up and you just feel awful. You can't quite put your finger on it, but your anxiety is high. Your confidence has just been knocked completely. From somebody that's gone from being quite confident and able in their ability at work, in their home life, suddenly you feel like you can't leave the house, you can't get out of the car, you couldn't possibly go into work. And it would only take one little mistake or a near mistake at work, and that would just floor you. You think, I can't do it, I can't do this anymore. And so lots of people, lots of women in their 40s think, I can't hack this anymore. I've worked really hard to get to this position, but I just don't want to continue feeling like this. So I'm going to take a lesser paid job, maybe drop a grade or two with my work, less responsibility, less pressure, maybe do some less hours. And this is how it all starts. And what I always say to people at this point is, don't make any decisions like this until you've spoken to a health professional that specialises in menopause. Unfortunately, I've seen quite a few ladies that have had very important jobs, and they've actually taken early retirement, and they've realised that actually it was menopause and it could have been prevented with the right support, the right help, the right understanding, and the right policies within the workplace to support you and acknowledge this is how you could potentially be feeling, can make all the difference. And it's about the increased training and awareness of how menopause is going to impact upon you that will make all the difference. It's knowing that this is how it can make you feel. Soon as you have any of these issues, just be like, have like a radar. Oh my gosh, this is menopause. I need to do something about it. Because you don't want this to get worse. You don't want to be making serious mistakes. You don't want your anxiety to increase so that you're not going out of the house. You can't go out anywhere. You're distancing yourself from family and friends, etc. It's about having that awareness so that you can see the signs. I love that term, mojo, your vavavum. It's that thing that makes you. And menopause seems to sort of like just knock that out of you. So just knowing about this. Low mood, flat mood, joylessness, emotionless, good terms. And I use these terms quite a lot, because that's exactly what it is. Depression is slightly different, because if you've had depressive symptoms or been on antidepressants long term, menopause will just make it worse. However, the majority of women that I see generally haven't had depression other than your standard blips through life. But during menopause, just hits you suddenly, and you just got this really low mood. And people are always saying, but I'm not depressed. I know I'm not depressed. I just don't feel myself. And this is what we have to consider as low mood related to menopause. Distancing yourself from everybody and feeling that you can't cope. Your brain's not working properly. You're getting muddled quickly. It's like you feel that your whole body is just on slow motion. Nothing makes sense. It's just, it just reminds me of like baby brain. You spent sort of like months and months having baby brain where you just can't focus on anything in particular. And it's that same feeling again, because it's hormone fluctuations that are making you feel like this. But you do tend to push yourself away from everybody. You don't know how you feel yourself. You can't explain it. You just don't understand anything, and you push everybody away, family, friends, and partners in particular, because you do feel lonely and you do feel isolated. You feel that nobody else is experiencing what you're going through. Nobody understands you. Nobody gets you. Everybody winds you up. Everybody irritates you. And everyone just seems out to get you. One minute you're crying in the corner, the next minute you're really angry with people, and you don't really know whether you're coming or going. And it's a really horrible place to be. And there's that horrible feeling of, where have I gone? Where's the old me? You know, that vivacious, confident person that would take on the world, didn't care about anything. Where's that person gone to? And you look at yourself in the mirror and you're thinking, I'm just not the person that I used to be. And it's a really horrible place to feel like that. But remembering this is menopause, this is hormone deficiency making you feel like this. And you will find that person again with the right support. Thank you. So what will help? Well, as you probably all know, I'm a great advocate of hormone replacement therapy. I take it myself. I prescribe it lots and lots every single day. And that's because I understand how it works in the body, why we need it, and the risks and the benefits. So hormone replacement therapy, as we've said, menopause is a hormone deficiency. If you're deficient in a hormone, by replacing it, you're not going to be deficient anymore. And so the HRT that I prescribe, what your GP prescribes, what menopause experts prescribe, is what we call body identical. It's the same hormones that your body is no longer producing, and we're just going to give that back to you so that you won't be deficient anymore. Why take HRT? Well, it's about improving the symptoms. So you don't have to take HRT. It really is a personal choice. But it's making that choice whether you think it's what you want to do. But whatever decisions you make has to be based on fact and evidence. Please don't base it on assumptions that, you know, somebody down the road once said that their mother got breast cancer from taking HRT. Let it come from the horse's mouth. Do your own research. Speak to qualified health professionals in menopause. Look at proper, legitimate medical sites when it comes to menopause, because you're going to get the facts then. And then whatever decision you make that you want to do is going to be the right decision for you. Because so many people say, well, I'm not sure about HRT because I think it's going to give me breast cancer. Well, there are risks when you take any prescribed medications and any non-prescribed medications. The risks for absolutely everything we say or do. However, the risks of HRT are low to virtually zero. About 10% of breast cancers are hereditary. So that means 90% of them are chance, lifestyle, unfortunate bad luck, the way things are, etc., which means that we've got no control over that. However, when we look at our lifestyle risk factors, there are things that we can do to reduce our risks of developing cancer and improving our long-term quality of life and our long-term health risks. So we know by reducing alcohol consumption, not smoking, eating a healthy Mediterranean style diet, getting exercise, cardiovascular, and looking after our positive mental health. All these have huge implications to reducing our risk factors. So, you know, people are saying to me all the time that, you know, breast cancer, breast cancer, breast cancer. I'm probably more concerned if people aren't taking HRT and their risks of long-term health complications because of it. And also, I think it's once people know the risks and the benefits, what HRT can do compared to the risks of developing breast cancer, then you can make that judgment yourself. If you do not want HRT, or there's either you've had breast cancer and you can't have it, or you don't want to take it, then the GP can prescribe you antidepressants that may help some of the symptoms. Obviously, we're dealing with a hormone deficiency, so antidepressants are not going to fix that. However, you look at what the main symptoms are you're experiencing, and then certain medications will help combat those main symptoms. If your GP won't prescribe HRT, and unfortunately I have to deal with this a lot, I have lots and lots of doctors that are giving inaccurate information or just saying they won't prescribe it at all. or literally saying the completely wrong information. They're saying they won't prescribe it at all, either from their own personal beliefs, or they're just completely out of date with prescribing HRT or knowledge of menopause as such. And also lots of doctors are saying to patients, I don't know anything about menopause, you'll have to see somebody else. And there might be a female GP within your GP practice that will prescribe it for you. There's generally always a GP within your practice that will specialise in women's health, and it's generally going to be a female GP. So worth asking about it. But, you know, just saying that you won't prescribe it isn't good enough, because would you say that to a diabetic patient that you wouldn't prescribe insulin for them? Would you say that to somebody that had low thyroid levels? No, you wouldn't. And so why do GP say that? And it's one of those things that hopefully in time, with education and increased knowledge and awareness of menopause, that will change. If you've got a family history, well, it depends what family history is. You know, family history of blood clots and strokes, there'll be some types of HRT that probably wouldn't be advised, but for the majority of people, they will be able to have HRT if they've got a family history of strokes, of heart disease, because remember, the HRT has a very positive effect on your cardiovascular system. So, you know, you're going to be really supporting your heart and your blood vessels, and lowering your risks by taking estrogen rather than not taking it. So it's a case of, you know, if you do have very strong family history of certain health conditions, you need to speak to your GP. You may need referral somewhere to run through it all as well, or certainly going through the NICE guidelines, looking at family history as well. How long can you stay on HRT for? Well, you can stay on it for life. It's not something that you have to take short term. Lots of people say, my doctor will only prescribe it for 5 years. That's quite an outdated view. It used to be advised for 5 years, but the reality is that you take HRT for as long as the benefit of taking it outweighs any risk. And obviously you can stop HRT whenever you want to. It's a personal choice to take it, but do be guided by the health professional's choice. If somebody says you really must stop this, I saw a lady a few months ago, and her GP had prescribed her HRT, and she wanted to talk to me about the management of the symptoms. She then contacted me to say that she'd found a breast lump, and I said, because I haven't contact the doctor, but I'd be strongly suggesting you should stop this. She said, I've had the scan and they do think it's cancer. And I said, although I haven't prescribed it, I would talk to your GP, but I'll be thinking you need to stop this straight away, because you just don't know. And it was cancerous. But that was just one of those instances. It wasn't related to the estrogen. It was just one of those things, but she's had her HRT stopped. So she won't be able to go back on it again, or certainly not in the early stages anyway. But for everybody else, you know, there's certain estrogen blocking medications that you wouldn't be able to have HRT. But for everybody else, you can stay on HRT. So that's estrogen, progesterone, testosterone, for as long as you possibly can. And you will then get the benefits of the HRT. Thank you. So what else will help? I mean, I can't say how strongly that talking to family, friends and colleagues helps people. That support, that camaraderie, that we're all in it together, let's support each other, it works wonders. We all know a problem shared is a problem halved. And the more we talk to our friends and family about how we're feeling, and it might be that you're talking to somebody that just can't open up and actually disclose that they're actually going through a really bad time. They're hiding it all really well. And so you just coming open and saying, gosh, you know, I'm really struggling with my menopause. It's a bit of a crippler, isn't it? And I'm really struggling with the symptoms, or, you know, gosh, you know, I'm having a flush again. Anything like this, you're talking about how menopause is impacting upon you. If you've got friends of similar age group, you're all going to be experiencing similar. It's just some people will talk about it and others won't. But talking about it makes it more normal. And the more we talk about it, the more normal it becomes, the more the stigmas will just die out. And we won't have these issues where people won't discuss it. It's a bit of a taboo subject, and it's all hush hush, whisper whisper. We've really, really got to move away from that. It's not acceptable anymore. I'm very open and honest about menopause, and I think we just need to continue to be open, tactful, but open about it, and make sure that everybody within the workplace is aware of menopause policies and guidelines. And if there aren't any menopause policies and guidelines at work, then we do need to contact our managers or HR and say, we need to get these put into place. Because if you are experiencing symptoms at work, then you've got nothing to go back on to protect you or protect your employer if there's any litigation side of things. And, you know, if you've got no policy to follow, then you haven't got a leg to stand on, really. Menopause champions, obviously I gave that talk a couple of weeks ago, feels like a lifetime ago now, where we did the menopause champions at work. So there's going to be people within the workplace that work for these trusts and the councils, etc., that have done all the training on menopause champions, and it's a case of just getting this on board and make it and running with this to support people within the workplace. Other things like counselling, CBT, cognitive behavioural therapy, they're very, very good. So again, if some people don't want to take HRT or can't take it, or want counselling and CBT as well as taking HRT, you know, please, it's really, really beneficial. We all need to talk, and by offloading, it generally helps us. And by talking about what's troubling us and what's bothering us and how we're feeling, it tends to sort of like we get the words out and we've said it, we haven't got it bottled up anymore. It becomes real, and we then have to face it and deal with it and move on. So it's very cathartic. So I do strongly advise counselling and CBT. And there's lots of training. I did some training about CBT for the treatment of hot flushes and night sweats for people that were unable to have HRT. And it was really interesting. There's actually quite good success rates with it. So certainly something to worth consider. Exercise, really good at reducing your stress hormone levels, increasing your lovely feel-good hormones, shifting the weight, and very good for positive mental well-being. Looking at your lifestyle factors, thinking what you can do. Do I need to increase my exercise? Do I need to lose some weight? Do I need to sort my diet out? Do I need to stop drinking for a while, or certainly reduce that? All these will help with your symptoms. If you're drinking excessively and you're feeling groggy, or you're not sleeping correctly because of it, all these will be impacting on you, and you need to address those things. Hobbies and interests, again, you know, you might be the fact that you're thinking, oh, you know, I couldn't be bothered to do any of these things because of the menopause, when in fact getting involved with hobbies, whatever that is, whether it's gardening, aerobics, cleaning your car, anything like that, it gives you a focus. It takes your mind off how rubbish you might really be feeling and all your worries, and it gives you something very positive to focus on. Really get involved with it. It will boost you, make you feel good about yourself, and that's fundamentally, that's what it's all about, isn't it? Do look at some social media. Some can be very beneficial, but do be very selective what you're looking at. Do take things with a pinch of salt with some things, and make sure that they are legitimate, qualified medical professionals, really, that you're following their advice. Thank you. So just to recap then, we said about what the menopause is. So the menopause is the ending of your monthly periods, whereas your ovaries are no longer producing hormones at sufficient levels. So the perimenopause is the stage leading up to the ending of your periods. So that's when your ovaries are just starting to shut down, or thinking, I'm just going to go on the go slow now, and they're producing less and less hormones. And as the hormones are fluctuating downwards, you start to develop the symptoms of hormone deficiency. The signs and symptoms of perimenopause is what we've been discussing. You know, your hot flushes, your night sweats, anxiety, aching joints, low libido, lack of confidence, frequent urinary tract infection symptoms, dry itchy skin, dry eyes, vertigo is another common symptom of perimenopause as well. All these are due to, or can be due to, lack of hormones. Hormone replacement therapy, you're just replacing the hormones that you're no longer producing in good enough amounts. And obviously in the post-menopausal, your ovaries aren't producing any hormones, so you are going to be deficient in those hormones. And it's about choices. You can live without those hormones if you choose to, or you can choose to supplement those hormones that will improve your quality of life and your long-term health. It's about seeking support from people. It's about talking, getting support. If you're struggling with your symptoms, absolutely must speak to medical professionals and people that you can get support from. Thank you. So support. We've been presenting on menopause since March, and we've had lots and lots of conversations and increased everyone's knowledge. We've supported, loads and loads of people that work for the trust with these sessions. So it's knowing that that information is all online for you to access it at any time, just to refresh your memory and use it as like learning tools as well. We're going to have a question and answer session next, and then we'll have the Menopause Cafe. Make sure that if you need support in the workplace, you do discuss your symptoms with your line manager, HR Wellbeing, and Oki Health. That's my website there, borntocare.co.uk. Please have a look at my website, and I've got lots of links to Facebook and things on there as well, in which you can access information about what I do and about menopause generally. The Women's Health Concern.org is a very good website to use to get lots of information about menopause. Then you've got the British Menopause Society, and then there's the NHS website there about menopause. And of course, you can seek help and support from the Black Country Healthcare Trust and the Psychological Wellbeing Hub. Thank you. So just to say that this is the ending of our monthly sessions. You can access the presentations as a resource on YouTube. Contact your menopause champions within the workplace. If you don't know who they are, then do a bit of digging around, find out who they are. If not, maybe speak to Tammy or Sam Skelding as well to find out who possibly your menopause champions are in your area. Do seek their support, particularly if you're struggling with your symptoms at work. Menopause Champions is a supportive role. It's not about diagnosing, it's offering support, guidance and networking and pushing you in the right direction so you get the help and support that you need. So menopause awareness, what we've been doing really, it's about continuing to support everybody in the workplace. If you can see colleagues are struggling with symptoms, then a bit of sympathy, a bit of empathy, and say, I know how you feel, let's see what we can do to support you. And get in touch with Menopause Champions, or look at the PowerPoints again. Recognising menopause in patients that we're treating. I think this is really important. This whole presentations I've been giving has been focused on the staff and supporting staff, but as a line here, do think about your patients, particularly anybody that's working in gynae or breast cancer awareness. Or any of the people looking after any older women, just be thinking about menopause and how it could be potentially impacting upon them. Signposting people to the right places. And it's all about improving health and well-being of women. And it's really, we're talking about keeping women working in the workplace happy, healthy, and productive. And, from a financial position, the longer we can work, the more hours we can do, the more our pension pot will be at the end of the day, which will give us a better quality of living. So it's about improving information and health and well-being. Thank you. So just to say a little bit about what I do. I run private menopause services in Worcestershire. I do discounted consultations to all NHS staff, fire, police, ambulance, etc. So anybody that's affiliated with this trust. I've got clinics in Worcestershire, and I do online consultations, and I support women all over the UK and health professionals in Europe as well. I prescribe all types of HRT, which can be prescribed. I email prescriptions to a clinic and it will be posted to your home address the next day. I provide all types of consultations, and I also write to GPs. The way I work, it's very much that it's a team. It's not me against a GP. It's about giving you the best possible care so the GP is informed and can continue your care and support you long term. And I can prescribe ongoing support and prescribe long term as well. And for any more information about me and the services that I do, you can look at my website or drop me an email. Thank you.